Welcome to the Helping Hands Way, People, Lean, Strategy. This is a podcast for nonprofit leaders doing real work with real teams, real clients, and real constraints. I'm Doug Rawson, Executive Director at Helping Hands Orillia. In each episode, we share one practical play, how we approached a challenge, what we tried, what changed, and what we learned. No theory for theory's sake. Every conversation includes a playbook drop, a tool, template, or checklist you can adapt in your organization. Real work, real wins, the NFP playbook. Welcome back to the next episode of Helping Hands Way. Kristen, it's good to see you. It's been several weeks since we've been together. We started the first episode together, working through paper to precision, lean moves that stick. We moved on to the next episode with Alex talking about people. Last episode, Joe joined us to talk about the boardroom. And today we're joined with Candice. Candice, welcome.
Thank you very much for having me.
Candice, why don't you give us a little bit of an introduction to who you are? And we're proud to have you on the episode today.
Yeah, my name is Candice. I've been with Helping Hands for 2 years, just over 2 years now. I've been a PSW since 2015. And I've had lots of experience in long-term care, retirement, even the hospital. And this is my first community personal support working job. And I absolutely love it. Love being here.
Thanks, Candice. And Kristen, welcome back.
Thanks. Excited to be here.
Well, this is going to be a good episode. And I'm looking forward to our discussion we're going to have today, Candice and Kristen. And today is really all about designing a system that works around the most important person, the client, and how we bring forward client concerns and frustrations with the system and system design. We all know clients and clients' family members and loved ones are accessing a variety of services all the time to be able to meet their needs. And as care providers, often we're the ones that are looked to for those answers. And if we don't design a system with the client at the center, sometimes it can seem disconnected and it can cause some confusion. It can cause some frustration. And it can be actually overwhelming to clients and their loved ones. But I'd also say it can equally be as concerning and frustrating to staff because you are the one that's facing this. And Candice, I appreciate you being here to bring that perspective to us today. Before we get started, Chris, I'm wondering if you can tell us, you do a lot of work with partners and community partnerships. If you can kind of give us a little bit of an example. You know, clients often feel like they might be bouncing from one system to another, one intake process to another, one system to another, and they might not be able to get the end result that they're looking for. And it can be hugely overwhelming. And navigating through that system, as providers, we're being leaned on as the experts. Can you kind of give some preemptive examples of what the system design looks like and how frustrating that is for clients and their loved ones?
Yeah, for sure. So, navigating the health system is not simple as a consumer of the system or as a provider in the system. I think we all struggle with navigation. We all struggle with understanding what each other's role is. I think there can be room for a lot of duplication in services and navigation. And these aren't new problems. These have been problems for years in this sector, and it exists in other social support sectors as well. I think one of the biggest, sort of shared perspectives that I hear from clients is, I didn't know that your organization does that, or I don't know what your eligibility looks like. I don't know what your geographic region is, because it varies by provider. It varies by funding model. Those of us that hold funding provincially are, bound by different rules than those that are private sector or hold municipal funding, for example, or, generate their own. So everybody's sort of limits, everybody's abilities to support are different. And, it's impossible for an individual to carry all that information and know it when you're trying to help a client who's sitting across the room from you who needs navigation and supports. So I know a lot of effort for many years has gone into how we more appropriately navigate and catalog what services are available, but also how we maintain it because the landscape changes all the time. I think one of the biggest focus areas over the last few years and that we've really tried to contribute to is, how those partners work together to leverage that unknown because it exists. But we've had some great findings in working with our partners to try to support clients to navigate the system, but ultimately support our staff to navigate that system.
Thanks, Kristen. I think you've identified a lot of opportunities in the system, but also what some of those challenges are. And we do hear often, the concern often is the pathways themselves, how we navigate them. And often there is a lot of duplication. And we really need to work on how we can streamline those and really, to your point, make the system and the navigation more effortless. Candice, as someone who's front and center to the care provision and closest to the clients, often we can see that clients are often stuck. They're not sure who to turn to. And I would argue you probably get more of that feedback from clients on a regular basis on how frustrating this can be. I wonder if you have any examples that you can share with us about what are those things that clients are saying to you when it might be something that you might not traditionally provide, but you know that there's a need for more.
Yeah, absolutely. And I do agree with Kristen there. A lot of them don't use internet, and some of them don't even use phone. And so it's really hard to get services when they don't have accessibility for communicating with the agency or whatever they're looking for.
So great point, Candice. And Kristen, we hear this often about accessibility and barriers to accessibility. And I just want to highlight, we wouldn't hear the importance of accessibility with things like internet and telephone access if we don't hear the client voice. I think Candice brought forward something very real and dear to what's important to system design and really having all the players. I wonder if you can further build upon, how we can make sure that the system's responsive, but we're also looking at, are we making it that we're removing barriers and accessing care?
Yeah, for sure. I think there's a lot of opportunity. I think understanding what the needs of the clients are, how clients are accessing your partner agency services is another opportunity that I think is often overlooked. One organization offering, electronic access to service, is there a way to compound and share that resource or share that service rather than, one being a paper intake, one being a telephone intake, and I think we see that variety quite often. And clients don't really know how their information is or is not based on privacy rules shared. I think there's a lapse in education and how things can be shared. We often hear, you got my referral from the hospital. Did they not send you my file? Well, they didn't, because we don't share information in that way. So I think access is really varied for partners, services, hospital, family health teams, as an example. And, it creates disjointed pathways for clients they don't really understand. And even as a provider, are difficult to explain and rationalize to clients. So I do definitely see where we create barriers in referral pathways and transfer of information just through our own systems and lack of integration in systems.
So, Chris, I don't want to give away our entire episode, but in a couple of episodes from now, we're going to talk about lean, and we're going to introduce the concept of lean. And we're going to talk about mapping out a client's journey. And I think what Candice shared with us about developing a system that works around the client you serve. And for example, if you don't have internet access, phone access, I'm not going to be able to do a phone intake. I'm not going to be able to do the intake through the computer. And I think that feedback is so important as we design that program. And we'll dive more into lean and how we do that. But I think it's important that we understand as we do design these systems, we need to understand how decisions are made, how the intake gets completed, how the access to information is completed. And we need to use all that data points. Kristen, you just give us an example. What are some of those important aspects we need as we start looking at, and we'll use removing barriers from the system? What are those different pathways we need to be considering as we start to design the system?
There's a number of pathways, as you know, and we've really taken a step back to look at how clients access our services internally and how it aligns with other services. We've looked at and implemented some software programs that help us share that information system to system. So, for example, if one of our navigation team partners in the community that are not employed by our organization have a client who needs to be referred to a program with us, are there ways where behind the scenes the client's personal health information and data can safely and securely be shared with our organization that integrates with our electronic medical record system? This eliminates duplication for clients and having to retell their story, and basic demographic information even is frustrating when they have to say their address 4 times to get to a simple service. Is there a way for us to streamline that? So we've really tried to look at what systems our partners are using and how it might integrate with what exists in our organization, or where we may need to transfer or onboard with new systems that make that client onboard experience more comfortable for them, less stressful for families. They know information's being shared. All we need to do is a quick validation rather than start the process all over again from the client's perspective.
So, Candice, We started talking a little bit about how clients access services and how they navigate the system to be able to get the support and services they need. And you identified that we need to remove the barrier. And the barrier could be internet, it could be telephone, could be our own system that we've put in, whether it's a paper intake or otherwise. And Kristen's talked about how we can integrate that with other system providers to provide a more wholesome approach. I wonder if you can share with us kind of what does that journey look like from the client's perspective as we introduce a pathway, an intake, a mechanism that we didn't include that client, and how did that cause a barrier or concern? What are the things you've noticed and heard about?
So I find when I go into a client and they don't know exactly why I'm there for a shower. I'm a personal support worker, and they wanted housekeeping, and they weren't aware that a PSW was coming. They thought housekeeping was coming.
Great. So I'd like to talk about that a little bit more, Candice. So, a client's expecting a certain level of service and you're expecting to deliver a different level of service. Tell me, what is the client experiencing? What are they saying? What are they communicating? What's that client experience? And I'd like to know what's your experience because you want to meet their need and what are you thinking at the same time?
Well, the client is very frustrated and sometimes gets upset, not always, but there's tension and you can feel it. And then that puts tension on us as a PSW or any staff going in to try and make the appointment as smooth as possible. And yeah.
So great feedback. And, often we hear about this frustration. I love how you mentioned about tension and you said we feel it. And I think this comes down to clarifying roles and expectations and understanding what that delivery is about. I think adds further clarity and certainty about the work that we do. And you adding this comment about tension and frustration so important. And Chris, I go back to what we talked about regarding mapping. And I think we can't fix what we don't measure, what we don't know. And I think to your point, when you talked about mapping and looking at that integration with the system, this is no different what Candice is sharing. We need to map, we need to illustrate what is Candice expecting to deliver from a service. We also need to do the same thing. What's the client expecting? Wonder if you can draw a parallel there.
Absolutely. I think, all of these issues come down to communication and understanding of what the programs and services are. As you mentioned, as a staff member, you want to know what service you're there to provide. You don't want to surprise anybody. We're there to make lives easier, not more complicated or confusing. And I know we hear internally from our feedback line and from our various feedback mechanisms from family members who say, I was looking for this service for my mom, but this isn't what I'm receiving. And whether it's a disconnect in their understanding from onboard, whether we didn't, clearly communicate what the service offering is, it just adds to the tension and the stress of the family in a very vulnerable time in their lives. They're trying to get support to remain independent, trying to make sure family members are taken care of. And so that's the last thing that people need when they're trying to navigate the health system at this stage in life. I think there's certainly parallels between understanding the process, understanding the inclusions or exclusions in a very clear way, and everybody who's involved in the care from a partnership perspective, administration, leadership, to frontline, to homemaking, to whatever service you offer, right to clients, families, and support people. I think everybody needs to be really clear about what's expected, what will be delivered, and what the timelines look like. I think we need to be clear about that as well.
Thanks, Kristen. We've had some good discussion so far about navigation. And navigation is not just how you access different service providers and how we integrate with the bigger system, but it could be what you mentioned, Candice. I arrived to deliver X service today. And what is that service provision today? And really, navigation is not always about speed. It's not about how quickly we complete the task. It's about how clear it is, the certainty of being able to deliver that. And I want to go back to some words you said, Candice. You talked about frustration, you talked about the tension. I'd like you to tell us from your perspective, being the care provider, using that example you did, and you said that the client feels frustrated, and you said the tension. What is it like from that staff member who is then to deliver that level of care, and there's a disconnect from what the client's expecting to what you're expecting to deliver? How's that being received on your end when you're trying to make the best care as you can for the client?
Definitely more frustration on us. Yeah, we just want to be there to support the best that we can. And when they we're thinking of a totally different service coming in and they get, upset and frustrated. That takes time away from us and how to explain, why we're there and what we're going to do. And so it's definitely time too, as well, that it takes. And it can become frustrating for us for sure.
If this episode's providing value, if it's helping you think differently or apply something in your own work, consider supporting our mission. You can make a charitable donation at helpinghandsorillia.ca/podcast. Your support helps us continue doing the work and sharing what we learn. I appreciate that so far, this is only our 4th episode, and literally all 4 episodes, the word frustration has come up every episode, where what we're finding is when things aren't clearly defined, we don't have a good, clear process, and the expectations aren't clear on both sides. It just adds frustration to the system providers. And I don't want to underscore on what you said, Candice, that it adds frustration to you and you're trying to do the best you can. And you said it takes time away from what you want to be doing. You want to be in helping that client with the work that you're asked to provide them that day. So let's talk about what needs to change. We need to change something in order to get a better result. And whether that's the frustration that you experience, Candice, the frustration of the client experience, whether it's the tension, whether it's the time taken away, or the integration with the system providers, we need to think different about something. We need to make a shift in order to get a better outcome. Kristen, if we look back to what Candice has shared about this frustration as an example, and that's on 2 sides, the client and our staff. When you look back, what needed to change in order to make that outcome better?
I think the first thing we need to look internally about how we were communicating services. Does everybody know what service we're there to deliver? Do clients know what services they're registered for or enrolled in, what the inclusions are and the exclusions are? Are they in the right path? And we did do some adjustment to client services. And ultimately, from a sector perspective, we definitely had to look at, do clients need to know every individual program name or service that they're involved in, or they need to know that the care needs are being met? Is that what they need to know? So we tried to bring that philosophy into the organization to say, does the client need to know that they're in this specific assisted living service, or do they need to know that they need somebody a couple times a week to come and check on them and help them with ADLs? And what is it that their goals are? And at that time, we didn't have established care plans. We didn't have clear use of our EMR to communicate care plans, validate them with the clients, and support people. There were a number of internal pieces that we needed to look at to make sure that we're all on the same page about what provisions were needed, how it was going to be delivered. We talk about scheduling, frequency, reminders, and all of those sort of logistical pieces. But also, do we as an organization know what we provide? Do we know who's eligible or who's an automatically, ineligible referral? Do we know what that is, or are we always stretching to make it work? Because I think, when you try to make it work and you stretch the boundary of what the services provide or what the organization can provide without partnering to move them to that next phase of care, I think that's where duplication happens. I think that's an additional contributor to confusion and frustration. So it was twofold. It was internal. Do we all know what we're doing, how we're doing it? And that includes our clients and frontline staff providing the care. And additionally, are we a strong communicator in the community to say, this is what we provide, this is how you access it, this is the referral pathway, this is what you can expect when you're seeking this type of service? And do we know where to go when we aren't the right provider? I used to hear from clients, and I still hear from clients, I've left a message at these 6 organizations looking for this type of service, and do you do this? Client phoning around to dozens of organizations is not a good use of anyone's time. Again, when they're in a vulnerable position and they're looking for help, we would hopefully be able to support that navigation to say, we don't offer this service, but here's who does. Or, we do offer this service, we can help with this component. So it eliminates, to Candice's point, they were expecting a home support service or homemaking service, and PSW service came. We're using a personal support capacity that could be better directed to another individual who needs it. But additionally, the client's disappointed. That's not the service that they registered for.
Thanks, Kristen. Candice, as Kristen was talking about communication and providing internal clarity, but also connecting that communication clarity to the community and our clients. And I really like the aspect about what does the service entail? What's the inclusion, the exclusion? I wonder from your perspective, are you seeing that? And are you seeing clarity from your perspective, being the care provider? And do you see that clients are seeing, as the communication has been fanned out, more clarity? And is that resulting in decreased frustration?
Absolutely. I know the services provider with Helping Hands. I could voice how to get a hold of Helping Hands. I do find that the clients do like pamphlets or something to look at in front of them. They really, really love something hard in their hands to look at. They find that helps a lot.
So, Candice, you're mentioning that clients have well received something in their hands. Is there anything that's been implemented from the organization's perspective that has been communicated internally, but has been shared with clients that has helped you navigate care and support clients with the navigation of care and support the journey while decreasing frustration on your side and on the client side?
Absolutely. We have a spring training every year, and this year we got a client handbook, and all the clients got that handbook. And it helps to clarify all the roles, basically everything the organization offers. So they were very appreciative of that. And it definitely helps staff too to navigate through some things with the clients with that handbook for sure.
Great. This handbook is on its multi iteration and it's gone through multiple versions with feedback from clients, from feedback from loved ones and family members and other stakeholders in the system, but more importantly, from our staff who are bringing back the feedback from the clients. I wonder if you can kind of share, because it kind of echoes on your conversation about communication and the work with the internal communication. Can you kind of give us an example how that patient handbook was born and kind of where it's become to today on multiple versions of reiterations?
Yeah, happy to. So we're very proud of the client handbook and how far it's come. So if I back up to early days, we didn't have a one bound document of information. We handed clients a 8.5 by 11 portfolio that had loose papers in it. There was a business card taped in it. There was, here's the privacy policy. Here's, the things were required really to give them, but little to no navigation support. So we decided to, evaluate what we were giving to clients. We did find, verbal communication. To Candice's point, clients wanted a hard copy document to reference and go back 6 months later and say, what did they say about that? Or what's included? Did they say they do, this program or that program? It was difficult to support clients with that without something that was more comprehensive than loose papers in a portfolio. So we developed our first client handbook, which included all of our brief rundown of the organization. We're a not-for-profit registered charity. We're founded in Orillia, all the things about us as a history, contact information, summary of all of our programs and services. So if there was you were enrolled in one service, but you identified something else might be beneficial, you knew the eligibility requirements, how to get a referral in, any copay costs that may or may not be associated. It broke down all of that information for you. Additionally, we had things like our no-go list or our list of tasks that were approved by the program or service and a list of tasks that would not be permitted from a safety and scope perspective. So that was very clear. The purpose of this level of detail in the beginning was really one, to have stronger communication, but also to support our staff in the community when a client might ask, can you help me with pet care? Well, pet care is out of the scope of the service that we offer. It's not a service we provide. Lawn maintenance is another example, but it was very clearly defined. Staff could reference the book to show clients, here's a list of the things that we're able to do. Here's a list of the things that we are not able to do. It made the sort of boundary and the expectations very clear for everybody, and it was consistent. There was no opportunity for miscommunication or, anybody to sort of stretch the capacity of what our programs and services can offer. When we talk about evolution of the document, that's where it started. We included things like our client charter, our feedback process. If you had complaints or kudos that you wanted to share, it's grown since that time. And we now include sort of helpful tips for our clients, things like emergency preparedness kits and local emergency contact numbers. There's a bit of, I shudder to call it advertisement, but some organizations and vendors that we've partnered with that have really demonstrated a focus on client safety, we've included some of their contact information in there as another reference point for clients to be able to say, I need this, and may or may not be a Helping Hands service, but I need this. Things like caregiver support networks and like I said, emergency preparedness, donation information, how to access our programs and services, and enhancements or benefits that clients may or may not be aware of, like our client portal. So they might hear us at intake with this overwhelm of information to say, here's the service you're going to get. It's going to be this time. And this is your emergency contact. We have a client portal, but it doesn't sink in. This gives them a chance to go back and reference the document. It gives our staff on the phone, if a client calls in and has a question, to say, do you have a client handbook there? It's, go to page 21 and this is the information. It's really been an invaluable tool in supporting clients navigate their own care, but still feel supported at the same time.
Thanks, Kristen. Candice, as we go back, I appreciate your comment about they like to have something in their hands. You've talked about frustration. You've talked about how we can better inform clients. And I appreciate you bringing forward the patient handbook today and how you feel that that's been a tool that's been well received by clients. I wonder if you can tell me a little more or even an example of how you may have contributed to the content within the handbook and what clients have told you or how you've been able to reference the book when you're delivering care when there's times of frustration you talked about. You said there's times of tension and frustration. How you can say, actually, it's in the book in here. And have you been able to use that in a way to be able to help support the care provision?
Yeah, for sure. I always reference the book. A lot of the clients that I go into actually have it right in the open. They haven't put it away. A lot of clients will get confused on some PSWs or house cleaners will do something different for a client. And then that's where the book comes in so handy. Like, it's in there. This is what the organization does and does not do, and the services that we provide and do not provide. So I definitely reference the book all the time. I even carry it with me, actually, when I go to see clients. I always have a few copies on me just in case I need to reference something for them so that they know that this is what we're supposed to be doing. And yeah,
Candice, do you find that this patient client handbook has helped to deliver clarity? Do you find it's helped to reduce the frustration? Do you feel it's helped remove that tension that we talked about earlier as one piece to the puzzle to making access easier and better for staff and consumers?
absolutely. Yes. Yes. It's made huge changes with our relationship with the clients when we go in. Yes.
So, Kristen, we talked about it in our first episode. We are providing a playbook drop every episode, and we are going to share our client handbook with the public to be able to utilize as an example. So, if you're another care provider and you're hearing about the frustration, if you're hearing about the tension that Candice shared and the confidence that Candice shared that Candice has had and the clients that she serves with the client handbook, please use ours as a template and a sample to be able to use as a starting basis for your organization. Candice, as we move forward, I'm wondering, as we look back about this navigation discussion we've had today and about some of these frustrations, are there any other pieces that you can reflect on that you think is another opportunity that we can further explore in making access easier as we remove barriers to designing the system for our client? Today, we talked about communication and making clear and removing some barriers. And we use the example of client handbook. But are there any other examples you can think about how we can really put that client front and center and make care provision even better?
Yeah, well, there are some clients that want other services outside of our organization, and 211 is the thing that comes to mind. They give this number a call and all the services come up. If we could provide that for the clients to just dial a number, an easy number for them, or just to gain access to everything that they're looking for on top of the client handbook. And that's what comes up in my.
Great. I appreciate that about 2-in-1. And really, this is about we don't need to be everything to everybody. And 2-in-1 is an excellent resource that connects individuals, whether it's an agency, whether it's a staff member, or a family and a client themselves, to other service providers. To Kristen's earlier comment about duplication of service providers out there and navigation, 2-in-1 can help that navigation process. Thanks for bringing that forward because I think it's a great tool, a great service and resource available for people. And I bet you it's in that staff handbook or the client handbook that you talked about a few minutes ago that can help clients navigate some of the opportunities and service provisions out there. Kristen, any other closing comments on the navigation and other elements that can help provide success on this journey?
The only thing I would add that we haven't touched on, but I've certainly mentioned in other episodes, is around the communication with the staff. So we began probably 3 years ago doing a quick introduction during day one of orientation with every new hire to say, these are the programs and services we offer. Here's the client handbook. This is what you can reference. So everybody's aware that it exists and how they can use it in their role. I think additionally, we've added, a ride along where somebody who's hired to be a transportation service worker performing rides for clients actually does a walkthrough of our transitional bed site so that if they're communicating with clients, they're able to recognize where some of our programs and services might help to help ease some of that navigation. I think that has certainly been a game changer for us in helping people understand what we do. What we found through surveys and, conversing with staff and understanding client navigation concerns is that some of our own staff didn't even know some of the services we offer because they were hired to do one role. They were trained to do one role. A client might identify a food security concern and they didn't even know that Meals on Wheels was held within our organization. So I think that's been significant as well. Confidence in the staff to know how to answer those questions that are maybe out of normal, out of context, not our typical service provision. But I think making sure that education happens right from day one when a new staff onboards as part of orientation has definitely helped as well.
Thanks, Kristen. Thank you, Candice, for joining us. This is our fourth podcast episode. I think this was great. I hope you'll join us again for another episode in the future. And really, this was about navigating care together. It's about designing the system that makes it easy for people to work their way through the system. Not that we need to be the solution to everybody, but as you identified, Candice, it could be something as simple as the client handbook about how to navigate, or it could be access to another service provision, whether it's 2 in 1. But how we work together to make the navigation system easier and better. Kristen, I'm going to join you back here in 2 weeks, where we're going to talk about measuring for impact and how we don't overanalyze by using copious amounts of spreadsheets. But until then, stay well. Thanks for listening to the Helping Hands Way, People, Lean, Strategy. If today's episode was useful, you'll find the playbook drop, templates, or tools mentioned linked in the show notes. If you're a nonprofit leader navigating similar challenges, share this episode with someone on your team or in your network. And if you want to keep learning with us, subscribe wherever you get your podcasts. Real work, real wins, the NFP Playbook.